A 56-year-old man from Ghana has suffered from recurrent attack of the hematuria many years. He present with suprapubic discomfort and cystoscopy found mass within the lesion of the bladder. What is the most likely diagnosis? So, as there is a mass in the bladder, that means it is the bladder cancer. So, what type of cancer may present in this patient who is 56-year-old and lived in Ghana? Here the options are squamous cell carcinoma, transitional cell carcinoma, adenocarcinoma, leiomyosarcoma and rhabdomyosarcoma. So what may be the answering option? So first of all, let's see the bladder malignancy. There are different type of the bladder malignancy, including the transitional cell carcinoma, squamous cell carcinoma and adenocarcinoma. So there are three important type of the carcinoma here: transitional cell carcinoma, squamous cell carcinoma and the adenocarcinoma. So which carcinoma type is the most common is transitional cell carcinoma, because the bladder endothelium, it is the formed by the transitional cell, but squamous cell carcinoma and adenocarcinoma also may occur. So let's see, in case of the Ghana, there is schistosomiasis is the more common than that of the UK. So schistosoma, that means schistosoma hematobium, this is an important pathogenic organism which is a parasite, and it may causes schistosomiasis in case of the bladder, and it may cause a recurrent episode of the hematuria, and those affected with the condition developed bladder neoplasm, and it is the SCC type, that means the squamous cell carcinoma type. So it is all about the schistosoma. So what type of cancer? It is the squamous cell carcinoma, though it is very rare in case of the bladder carcinoma. But here we can see 56-year-old and he lived in Ghana. So in case of the Ghana, there is schistosomia is the more common, and here we can see the recurrent attack of the hematuria and also suprapubic discomfort. It is the many years. Here we can see the many years. That means the schistosoma, it frequent attack, it is a repeated attack the bladder wall. But in case of the transitional cell carcinoma, usually it presents sudden, severe and acutely present. So as it present in the longer duration of the time, usually it is the squamous cell carcinoma, and it is caused by the schistosoma hematobium infection, and it is the longer duration of action. That means this is the recurrent attack of the hematuria for many years. That means a longer duration. So in this condition, squamous cell carcinoma. But in case of transitional cell carcinoma, had transitional papilloma not true. It is the if transitional cell carcinoma, it is usually the shorter duration, and adenocarcinoma, which is the more rare, and leiomyosarcoma and rhabdomyosarcoma, that means the sarcoma of the smooth muscle, sarcoma of the striated muscle, they are also very rare and almost absent in case of the bladder tumor.